creams, and we suspect some of these creams may have steroids in them. Now, with the management of skin bleaching syndrome, we usually reduce or take off the skin bleaching agent over time because most of them would have dependence. If you stop suddenly, they have rebound dermatitis and irritation. We recommend pH balance cleansers, sunscreen and sun avoidance, topical and oral antioxidants. We treat any infections if there are like fungal infections. Counseling is the main treatment because we need these people to be able to embrace their natural skin tones. And then skin bleaching syndrome is better prevented than treated. And so we need to embrace our various beautiful colors and educate people and campaign for all colors being beautiful. Now, what is the way forward? We need more public awareness campaigns. We need research and collaboration. We need to encourage interdisciplinary research. We need to investigate these new skin bleaching agents and what their adverse effects are. And the Nigerian Association of Dermatologists have been doing a lot of this already, actively engaging the public. We always talk about skin bleaching on the radio, on the television, and social media, in the markets, in the clinics, and we try to educate as many people as possible. For many, many years, we've been doing this to try to encourage people to desist from skin bleaching because we don't want to keep seeing the adverse effects of skin bleaching in the clinic. Unfortunately, we're still seeing them and the patients are getting younger and younger, fortunately. And we usually advise that people avoid products with all these so-called adjectives because these adjectives usually connotes that there's a skin lightening agent in the even if it's not disclosed. And then also the triple action creams tell people you don't need to use a steroid containing cream unless it's prescribed by your doctor or your dermatologist. So what is the role of regulators? Cosmetovigilance, just like pharmacovigilance, which is enforced globally by government agencies. And we're so happy that we have. Yeah, I'm almost done.
Dr. Paul, 3 more minutes. Okay.
Okay, thank you. Thank you. We're so happy that we have NAFDAC here with us to discuss about this. The regulatory bodies, we are happy to work with you so that we can have better regulation of cosmetics. And the regulatory oversight, let's make it digital. Let's have an app where people can report adverse effects of cosmetics. So it will make life easier. You know, technology, we need to include that in cosmetovigilance and train health professionals on how to recognize and report these adverse effects. We also need to engage the manufacturers because they need to be more ethical in manufacturing things and let them know it's not just about making money. Your lives are at stake here. Make sure that your products are safe and they comply with regulations, and you also educate your consumers how to use them. And then the role of healthcare professionals, we need to constantly report adverse events. We need to also consult with manufacturers for product formulations and educate the consumers and the public. We need to all collaborate. And then the media plays a major role. The media must help with advertising, and celebrity endorsement must include people of all skin tones and skin colors. And we must be careful not to promote a lighter skin as the standard of beauty. And we can also educate the public about the adverse effects of skin lightening. Now, there needs to be a multi-sectoral approach where we all work together so that we can develop stricter regulations and enforcement, address the concerns. The problem is the hyperpigmentation. Let's look for safe and effective ways to manage hyperpigmentation. And then policies need to ensure representation of all skin tones, and the education and awareness needs to continue. So in conclusion, I would say skin bleaching is a major public health issue in Nigeria. Dermatologists, pharmacists, regulatory bodies, and the media all have a crucial role to play. We need to work together more. And there's need for stronger policies and public health campaigns. So we want to encourage ethical medical practice. We want to make sure that people are not prescribing triple action creams indiscriminately, for instance. We also need to find a way to restrict steroids because that is a major issue. And then all these beauty spas opening with IV, glutathione, and all those things, we really, really need to find a way to shut them down because dermatologists have concluded that this is not a safe practice for skin lightening. And we also need to continue to educate the community and create more awareness initiatives. So there's this proverb I love so much that if you want to go fast, you go alone. If you want to go far, you go together. And so we all need to work together to be able to fight this issue of skin bleaching. And remember that all skin colors are beautiful. We should teach that to our children from an early age so that they don't grow up feeling that they need to be a skin color that God did not create them to be. Thank you very much for listening. And I would like to acknowledge Dr. Akinfupe, who helped me with some of the slides, and the NAD, the Nigerian Association of Dermatologists, for this opportunity. And we are still here to listen to our colleagues and everybody else that is on the call. We hope to take questions and answers as well. And don't forget, our conference is coming up. The discussion continues. This is just the first part of this discussion, and we hope we can have more stakeholder meetings to discuss this public health issue of skin lightening and skin bleaching at our annual conference in June. Thank you very much.
Thank you very much, Dr. Cole, for that very elucidating presentation. I will just give a quick recap while we wait for the second speaker to set up his slides. Dr. Cole started with a definition of skin usement and production. He said whole lot of...
Sorry, can I share the slide for the second speaker before you continue? Or they're sharing
the slides? Yes, ma'am. You can share now, ma'am. Yes, ma.
Okay, thank you.
Also mentioned the complications, both cutaneous and systemic, and the use of triple action creams that are causing drug-resistant fungal skin infections. And these, as she presented, were backed by studies. We're also looking at the new resurgence of children being the latest victims of skin bleaching. And as usual, dermatologists are usually the first set of people who tend for complications. So way forward, campaigns, research and collaboration, and she also presented how much NAD is doing already. She brought about, she spoke on the warning signs on labels and the need for cosmetovigilance for both consumers, manufacturers, and spas, and the importance of utilizing the media. Permit me to recognize Dr. Idris Omide, the past president of NMA. I'm so glad you're here, sir. A very amiable past president. And to everyone that is here, please know that you are highly recognized. For now, we'll keep the questions to the end of the presentation. Please, Linda Halim, you have the floor.
Thank you very much.
Please. Thank
you very much, Dr. Ida. My name is Linda Halim. I represent NAFDAC, and I'm happy to be here. It's important to first state that, can you hear me? Hello?
Clearly, ma. Clearly.
Very good, thank you. Okay, it's difficult to barge in on people if you do not have a mandate. I want us to go to slide 2. The mandate behind what makes us do what we do. NAFDAC was established by a decree 15 of 1993 as amended by decree 19 of 1999, and now the National Agency for Food and Drug Administration and Control Act, Cap N1, Laws of the Federal Republic of Nigeria 2004. This act mandates NAFDAC to regulate and control the manufacture. It's important to note the adjectives: the manufacture, the importation, the exportation, distribution, advertisement, sale, and use of food, drugs, cosmetics, chemicals, detergents, medical devices, and packaged water, all collectively known as regulated products. Next slide, please. Now, why do we regulate? To achieve government's mandate, which is to ensure that we have a healthy and a safe, protected populace, to prevent unfair treatment, to ensure fair competition, ensure wholesome goods and services, and protect consumer rights. Next slide. It's important to understand what drives this. The size of the cosmetic market is large. Now, I have a few statistics. As at 2022, we noticed an upward growth to about 16.8%. Now, skincare accounted for 128 billion naira. This was statistics as at 2021. Next slide, please. If you look at the graph presented, you'll observe that there's a forward and upward progression. Next slide. Now, what are cosmetic industry growth drivers? One is rising population. Two, urbanization. Migration, the expansion of the modern retailing, adoption of natural products, and popularity of our local products. Next slide. The skin lightening market is expected to be worth $31.2 billion as at 2024, and I know it's growing. We have seen this in the last slide, how it's will I call it a pandemic? It cuts across not just Africa, around the whole world. Next slide. Last speaker talked about an increment of 28 to about 80%. In this particular data, which was obtained from CNN, Nigeria topped Africa at 77%. Next slide. Now, what is NAFDAC doing? The first thing we're doing is to have what you call full automation of the registration process via NAPAMS. Registration had first been a challenge when we had manual things. So what do? We automated our system. We also facilitated international trade through the single window trade portal. We also reduced congestions at the ports through PIDCAMs. We instituted what we call a CRIA regime, which is what we call the Clean Report for Inspection and Analysis, whereby you cannot bring in anything into Nigeria, cosmetics included, especially from high-risk countries like India, Egypt, and China, without having the NAFDAC representative lab there certifying that product okay. So beyond this certificate of analysis presented by the importing company, we have our own NAFDAC affiliate laboratories over there. They must pass those particular products before they come in. We also have what we call the decentralization of our registration process to cut down on the lead time, turnover time. We have the 5+5 policy, which has been introduced for drugs. 5+5 is also coming into cosmetics because we are trying to engage our local manufacturers. When you make local, it's easier to control what your people use. We also, next slide, let me just run through this. We also have the implementation of a robust regulation. We are having currently, it should come in this year, a recap or a review of our 2019 regulations for skin lightening products, the regulations for skin lightening products. This is further to what we had in 2019, where if you look through that particular one, it only mentions about hydroquinone, not to be permitted beyond 2%. We have observed a trend. People are mixing things in formulations. They are bringing in products like alpha-arbutin. They are bringing in oxybenzone. They are bringing on different types of products. So we're coming up with a robust regulation that limits what you can have in a formulation. We also have enhanced market surveillance. As you have seen in the past few weeks, we have done that with the drug market, bringing in as much as 87 truckloads of fake and substandard drugs. So we're moving into the cosmetics. I do not want to say this because, as you know, this particular operation is highly, it's coded, and we have to go in and do our work. We also have consumer and stakeholder enlightenment campaigns, both nationally, regionally, and internationally. Nationally, as we have, NAFDAC in 2022, 2021 and 2022, went around Nigeria. NAFDAC went around the 6 geopolitical zones, went to Abuja, went to Lagos, listening and enlightening the media, specifically health journalists, on the dangers of skin lightening. You will be surprised at the kind of feedback we got. I remember in one of the states in the north, we were told to mind our business, that their husbands liked them the way they were. We had statistics from this, which we have also put in helping to drive policy. Regionally, we are collaborating with our West African neighbors. Internationally, we're having other regulatory agencies call us forward to come to pilot their program and teach them what they will do in their countries and in their clients. Next slide, please. We talked about cosmetics and cosmeceutical products. It's important to know that NAFDAC had to reclassify or redefine cosmetic products. Now, for cosmeceutical products that are hybrid, they act both as cosmetics and as drug products in that they alter the body's structure or function. We have different regulatory guidelines and regulations for those coming. A very good example is your skin lightening products. They will no longer be under cosmetics. They will be cosmeceuticals, and they will be given that restrictive regulation and monitoring. We talked, my last speaker spoke about cosmetovigilance. I want to tell you that it's implemented in NAFDAC. We have the Med Safety app. It's actually an app online. You can download this. You can actually download and tell us what side effects you observe from the use of any item, whether drugs, whether cosmetics, whether food. You do this, it gets to our database, and we can store this for references. It eventually will find itself in an international or global database, but at least with Nigeria, we have our own database. What are the regulatory pathways for cosmetic product marketing authorization, product registration, inspection of facilities where we actually meet with manufacturers and ensure that only approved formulations are allowed, laboratory analysis, post-market surveillance, and pharmacovigilance. Next slide, please. Okay. We talked about cosmetovigilance. Next slide, please. Next slide. Can you hear me?
Yes,
next slide. We've talked about this. Now, what are the common challenges?
Thank you.
What are the common challenges in the regulation of cosmetic products? The ingredients. Now we have a lot of people bringing in things they do not understand. We have people, or will I call it, people who do not understand, non-technical people, I think that's the right word, non-technical people being made to mix things and produce things they shouldn't. We're also on top of that. Formulation issues, toxicology issues, labeling, a lot of false claims. You see overnight cream, fair in 24 hours, claims, the use of restricted chemicals and banned chemicals. And as you know, we're also having the use of those chemicals, which are also becoming security issues in that they are being used to make IEDs and things like that. Next slide. Now, we also have the widespread use and damage of skin lightening agents, the illicit markets and smuggling. And I want to make this particular appeal. We have people smuggling, like Nigerians travel. We are one of the most traveled people in the world. You come in with your bag from the UK, you see something you bought online, you bring it in and you dump on a shop. It's a small bag, but you go to the UK twice a month and you bring in those consignments. You're not bringing them for personal use, you're going to sell. So we have illicit markets, we have smuggling, and we have the use of the internet and medias. I don't want to mention our online sales shops, but of course, Wonga, you know all that. That's a challenge. People make their requisitions online, they pay, and these things are shipped to them. Limited public awareness, and we also have collaboration gaps. Next slide. I think we're going to run, if I can just go to slide 14 and 15, I think we talked about that. Let's look at slide 34 so I can run through. Slide 34, please. Now, it's important to note the mechanism of actions. Sorry, I think you've missed that. Go up. Mechanisms of action of other skin lightening products. First and foremost, it's important to note that 3 major skin lightening agents speak. Hydroquinone. Now, it's important to note that we in NAFDAC do not permit hydroquinone use beyond 2%. But if you notice in some formulations, what we are finding is people are having hydroquinone, alpha-arbutin, phenobenzone, all in the same formulation. They may even have non-competitive tyrosinase inhibitors like mulberry thrown into the mix. You have cholagic acid, you have ascorbic acid, and all that. Excuse me. Now, excuse me. We also have products which we call removers of keratinocytes. So many of this. So from our regulation, which will come out in a few months, it's actually in the, please, can I just take a cup of water? Please, just excuse me. Thank you. Thank you very much. Our regulation will be out within a few months from now, formally, because it's gone through all the readings that it should, will address this. It's going to come out with what we call percentage usage rates. If you look at formulations, you will find, oh, alpha hydroxyl acid. What is the percentage usage rate? What percentage in this formulation can I have? What can I not go beyond? So we have all that spelled out in this particular formulation. Now, the way forward. If you can go to the way forward, that's slide 36. Excuse me, slide 36. The way forward. I took time to, yes, the way forward. NAFDAC and government to strengthen policies, enforce stricter penalties, and enhance cross-border surveillance to curb smuggling. This is one. Now, I remember there was a time we had products that were coming in from West Africa, this West African skin lightening products, and they had quantities of mercury. Mercury is not allowed at all in our regulations. You cannot have mercury in Nigeria, but they brought these things in. For those that even had higher hydrogen, higher hydroquinone concentrations, we had to put a stop to them, and we blacklisted such companies. Now, dermatologists and healthcare professionals should educate patients on the dangers of abuse, the dangers of misuse. The general problem with corticosteroids is misuse and abuse. So we need to do a lot and advocate for safer alternatives. Now, for pharmacists, we ensure that, I'm rounding up. We ensure that only approved products are dispensed, we educate customers and report illegal products to NAFDAC. For the media, we want the media to use its influence. Can you hear me? Can you hear me? Can I continue?
It's like there's so many.
I can hear you. Please, the host should mute Juliana.
I can hear you. Let the host mute.
Thank you.
Thank you.
Now, the media should use its influence to discourage harmful beauty standards and highlight the risk of unsafe skin lightening practices. You're finding cases where children are now beginning to have skin lightening products made for them because it's nice to see, oh, my baby is fair-skinned and my baby wins this particular baby award. So we need to work with the media to discourage this practice. Now, for public participation, it includes legislation by the Senate and the House of Representatives. You will be surprised to find out that skin lightening products were banned by the legislative arm of government in Rwanda. They banned it by parliament. It can also happen here. It can also happen here. These are pictures. Next slide. Next slide. Next slide. These were interns who had worked with me. I call them I'm Black and proud, and I think I like the way their skin looks. So what are our consumer rights and responsibilities? We need to be what? Critically aware. We need to take action. We have to have social concern. We should look at environmental awareness and also form a solidarity bond with other stakeholders. Next slide. Now, what are your rights as a consumer? You have a right to basic needs, a right to safety, right to information, a right to choose, a right to be heard, and a right to seek redress and compensation, a right to consumer education, and a right to healthy living. So when you're seeking redress, you can either seek criminal redress, administrative or regulatory redress, or civil redress. Thank you very much. Thank you.
Thank you very
Thank you.
much, Halim, for that very in-depth discussion. As we can see, NAFDAC is taking this fight very seriously, and she has highlighted where there's need to regulate and putting us on the top of the chart when it comes to skin lightening, which is not measures for intensive surveillance, robust regulations in formulations, and need for enlightening campaigns by everyone. Skin lightening products are no more tagged cosmetics and are now under cosmeceuticals. She also mentioned the Med Safety app, which I think will come into play, and need for the public to be aware as well. I don't know if that's very restricted to the professionals, but if so, strengthening efforts, stricter penalties, and information on consumers' rights. And thankfully, there's a place for seeking redress so that the consumer doesn't just end up with just side effects. Thank you very much, Ma. And sorry about your calls. It's from Gafa Madeline around. I haven't seen that name. Yes, sir. Okay.
Hello.
Madeline. Okay, sorry about that. Yes, sir. Please, you can share your slides and begin your presentation. All questions.
Like I said before. Okay. Like I said before, I want to speak extemporally. I don't have any slide.
Okay.
Because yes, I've listened. Can you hear me?
Yes, I can.
Okay. Yeah, I just want to talk. Yeah. So, like, how many minutes do I have?
Let's say 5 minutes. Is this enough, or should we go straight to panel discussions? Maybe you can bring your presentation or discussion.
Better, yeah. It's better we go to panel discussion because I don't have any.
Okay. So quickly okay, sir. Noted, sir. So quickly just go to panel discussions. All speakers should be online. My first question will be to Halim. What are the biggest challenges in enforcing existing regulations on skin bleaching products in Nigeria? And how can NAFDAC and dermatologists collaborate to strengthen these efforts?
I need to hear that again. Could you go over that?
Efforts. Okay, Ma. I said, what are the biggest challenges we are facing in enforcing regulations on skin bleaching products in Nigeria? And how can NAFDAC and dermatologists collaborate to strengthen these efforts?
Okay. First and foremost, I feel I usually use one phrase. Work is easy, people are hard. If the people get to know the dangers, get to understand the dangers of the use and of skin lightening products, abuse and indiscriminate use. If they get to understand, they wouldn't use. If they get to appreciate, they wouldn't use. You can imagine us traveling. We traveled at a time to Maiduguri when it was not safe to be in the Northeast, just to make sure we drove this point home. And I remember when someone came in from Yobe and said, well, I have 2 wives. I prefer the light-skinned one. It's important to have this discourse. So what we want to do is talk to people, start from the family. For in every home, in every cell, there is an active person using skin lightening agents. Now, usually by the time the children are in secondary school, they have already started. NAFDAC has tried to ensure that she catches them young. We have this particular program. We called it it's a secondary school program whereby we go in and encourage children to write essays on the dangers of skin lightening. You know, nobody does things better than children. If you can get them to have a buy-in, you will have a generation whereby the thing is frowned at. Because there is a market, people will find a way. If there is no market, it will fizzle away. So I feel the human part is very important. With respect to how we, NAFDAC and dermatologists can partner, I'm so excited to be on board this program. I'm happy we're having this interface. I'm hoping we will have more. We're having issues with this, will I call them shops? I'm trying to get the word to call them beauty parlors, unlicensed people who do not have medical background, mixing products, even going on to have procedures that dermatologists are supposed to have. People actually engaging in skin peeling, using things as dangerous as phenol. For you to use phenol, you need to have a cardiologist on ground. I'm aware of that. So you have a lot of cases whereby people die in these clinics or in these spas due to indiscriminate use. So I'm hoping that beyond this today, we're going to have collaboration hand in hand, foot to foot. I want to let you know that you have my DG's highest assurances on this. I will make this possible. Whatever you need, if I will use the word, your shield is our shield, your sword will be our sword. We need to go beyond just winning this particular battle. We need to win the war. And wars will, of course, transcend generations. Thank you.
Thank you so much, Ma, for the assurance and invitation regarding this fight against skin bleaching. From Madahin, as pharmacists, the sales of over-the-counter steroids and triple-action creams without prescription is well known. How is PSN curtailing these actions? Hello, sir. Are you still with us?
Maybe he's not.
Sorry, can I still be heard? Oh, he's not around.
He's still with
let
us.
him unmute.
Maybe he's not close by. Yeah.
Okay, maybe he needs to unmute. Might be speaking, but forgotten that he's muted. Yes, sir.
Hello.
Did you get the question, sir?
Hello.
Okay, maybe I'll go to the next question for Dr.
I didn't get the move from one location to the other
please,
for me to
Dr.
hear
Cole,
you.
please, could you highlight?
He's actually trying to say something.
So
His
he's speaking now. Pharmacist Japa is speaking.
Okay.
Hello, can you repeat the question, please? Can you hear me? Hello. Hello?
We can hear you. She's coming.
Okay.
We can no longer hear the presenter's voice. I don't know if this is from my end or...
Yeah, I can't hear him as well.
Okay.
Dr.
Ma'am,
Are you audible?
He has been having network issues
Yes,
since.
yes. Let me just present your questions while we wait for Gafar to come on board, because I still can't hear him and he's currently muted. Okay, so your question, just in one or two ways, how, because we already heard we've been invited and given the assurance of dermatologists on board collaborating with NAFDAC. What are the ways we can work with them, and what are the roles of Nigerian dermatologists on social media in changing this narrative of healthy skin habits? Thank you.
Oh, thank you so much. Yes, we're so happy that we have NAFDAC on board, and we're really eager to work with NAFDAC to for campaigns, to also work with regulatory and formulations, regulation of formulations. As pharmacist Halim has rightly said, a lot of formulations these days are, we're not sure of their safety. They're just thinking about, oh, let's fix them with the most tyrosinase inhibitors possible. Let's hit them with multiple depigmenting agents without considering the safety of these things. And so it's very important for us to sit down together to discuss what risks and then do some research in our own environments, because a lot of the standards are made by the European Medical Agency or the FDA of the US. We don't really have the data or the studies done on our own, in our own people, in our own clients, and our own skin types. So we really need to start doing a little bit of, the research in that, and also, the animal studies, which usually is the first point of call. Because as she mentioned, there are some agents that are now banned in Europe that are still readily available. That's one. And then the other one is working hand in hand to discuss the cosmetovigilance. Like I mentioned in my presentation, I was suggesting we have a form of digital technology to be able to report all the adverse events that we see in the clinic and the associated cosmetics, because we see them every clinic. So it would be nice if we have an app where we can just type in, oh, take a picture, this is what we saw, this was the agent. Can we have further investigations as to what is in this agent? There are some creams I am sure they have topical steroids based on the adverse effects that patients come with when they get, but it's not listed on their list of ingredients. So we really need to do a lot more cosmetovigilance, and I think it would be great to work with NAFDAC on that. So those are two areas. And then the campaigns. As everyone knows, I'm a social media advocate. I'm a skin health advocate on social media. I'm always talking about skin lightening and skin bleaching consequences. And I want to encourage and welcome other colleagues, dermatology colleagues, pharmacist colleagues. Dr. Siri is also a passionate advocate about the beauty of the Black skin. We need more people who are, like doctors, pharmacists, and NAFDAC in the media space talking about these things on a regular basis, even if we have to do sponsored ads, because people that sell these bleaching creams, they do sponsored ads to sell them to get more traction. So if we have to do that, then let's do it so that we have more people seeing us, because we don't really have very many followers. But if we can push it, then we'll be able to get, because that's what really influences people a lot now, what they see on social media, on TikTok, on Facebook, on Instagram, and all that. So those are the few things. And there are some questions in the chat box. Maybe I'll just try to start typing to answer them. Thank you.
Okay. Thank you. Thank you so much, Dr. Ko. Very apt suggestions. Gafar, are you with us now? Hello, can you hear him? Can it be unmuted so that maybe that would help? Okay, still waiting. There are a lot of questions in the chat box. I'll just read them out that are actually for other presenters. So I'll just go right to it. Sorry.
If I may, there's a question here from Esther Okunola. She says, you mentioned high-dose glutathione and vitamin C as new bleaching agents. There are some of these agents that are added to skincare products in the form of powders. Are these also harmful? Does it mean skincare products that have these agents should be avoided? Well, glutathione is a natural antioxidant, and some in low quantities, it can be beneficial to the skin as well as vitamin C. What we're concerned about is very high doses being given intravenously, which has not been properly studied for its safety, even though it has an adverse effect of skin lightening. We are really concerned about the safety. And a lot of them are bought on the black market and may be contaminated with other things. I know that Dr. Akintobe presented a case of a patient who had an anaphylaxis from some kind of IV infusion at some point. And so we really need to be very cautious. And, at the end of the day, making people lighter, stripping them of their melanin, and you're living in Africa under the hot sun, they're just going to end up having more sun sensitivity, among other things. So the topicals may not be as potent, but even once a cream, there are some creams that claim there is glutathione inside, but it's steroid that is there. By the time they start using them, they develop striae and then hypertrichosis and thin skin. So I'm always very suspicious of creams that claim they have glutathione as well. And then organic creams are not bad if they are really organic. But then how do you know that they are really organic? That's the problem. A lot of them claim to be natural, claim to be organic, but a person is using organic creams, why is their skin getting lighter if they're using shea butter and coconut oil? And then a few months down the line, the patient is developing cutaneous candidiasis, fungal infection. Definitely, it's not just organic. It's not just an organic agent that's inside such products. So we really need to be very cautious. And then somebody just who has no knowledge of cosmetic chemistry, is not a cosmetic scientist, is mixing an organic cream in their backyard. You can't be sure of the safety of such a cream, and they should not be used.
Hello, can you hear me? I'm not the one that is offline. Hello,
Not
can you
really
hear her?
damage.
Okay.
Can you hear me? Am I audible?
Yes,
Yes.
you are now.
Okay. So that's for that question. I don't know if you want me to answer any specific question, Dr. Siri. Thank you.
Okay, thank you so much. Let me just quickly go to the questions for you. Dr. Idris Omedi, presenter, Dr. Ko. Presentation by Dr. Ko is quite interesting and educating. NAD public awareness and sensitization are acknowledged, but it requires to be heightened through collaboration with relevant groups and bodies. This is because truly bleaching is a public health concern from its cosmetic effects and highly economic value attached to skin bleaching product manufacturing. So question to Dr. Cole and Farm Halim. Why are these skin bleaching products not totally banned from the production? I think I'll direct that to Farm Halim.
Could you go over that, please, once more?
Okay, so the question is, why
Yes.
are these skin bleaching products not totally banned from production?
Why and what's not completely banned from production?
Skin bleaching
Skin
products.
lightening products.
Skin lightening
products.
Well, because I'm happy with most of us in the house are dermatologists. There are times you may actually have to have a patient go on skin lightening. If the person is having hyperpigmentation, either as a result of pregnancy, aging, one other, maybe a case of vitiligo, for instance, you may use within a particular period of time. What we're going against is the indiscriminate use. When they cut off the professional, they cut off the professional and take on that role themselves. They go on and they take products that are not authorized for them to use. They mix and they use for a prolonged period of time. So that's what we come against. There are people who legitimately would need the use of skin lightening products for a time. It should be under prescription. It should be prescribed by a dermatologist. It should be used for that particular length in time. It's not something that takes forever. But when you cut off the dermatologist, you now bring in products that are harmful, products that are banned, you mix them, you use them like forever, then we have an issue with that.
Thank you so much. Let's give an opportunity to Farm Madehin. So are you with us now? Apologies for the pitches. Okay, we'll keep going to the questions. Informa Edes, thank you. Is Tura soap, is it free of mercury now? Because it's readily available in the Nigerian markets. Are we allowed to answer that from Halim?
I can answer that.
Okay.
Any product coming into this country, for us to give it marketing authorization, the product beyond the CRI regime has to go to NAFDAC laboratory. We have several laboratories, very competent laboratories around Nigeria. We send them for all the parameter tests. We check for mercury. We check for mercury, we check for other skin lightening products. Mercury is banned. We do not even accept it as 1%. It is not allowed in Nigeria. If it came into this country, it was smuggled in. Like I told you before, work is easy, people are hard. So we do not authorize the use.
Soap contain mercury?
No, it does not. Tura does not contain mercury.
The current one in the market?
It does not contain mercury. You can remember Asepso, if you remember that Asepso, Crusader, and all that. We mopped everything out. There are new formulations because they had to submit new formulations, new batch manufacturing records to have products you could use. I want to assure you that there is no mercury in those products.
Oh, that's an interesting point today. I'm not too comfortable getting one, but it's good to know that people are reformulating brands that initially had very harmful products.
We actually, sorry, ma'am, we actually
yes,
had what you call, among what I told you about our online registration process. Beyond just registration, you have what we call a change in formulation. It's allowed. Okay. If you get up and find, like products, you will find certain things later on about something you've had in your formulation. If it's unsafe, you are permitted. We can even call you to say, change this. If you remember codeine, there were people who were having codeine in their cough syrups. Because it became a national concern, people had to reformulate their cough syrups without codeine. So I want to let you know that they still have their products in the market, but they don't have codeine in them. Because codeine is banned in Nigeria because of the security issue and the addictive nature with our youth. Thank you, ma'am.
Thank you so much, ma. Ngozi, Dr. Ngozi is appreciating you for that presentation, for the beautifully articulated presentation. I think we have some questions from others, but the dermatologists are tackling them in the chat box, so that will be fine. Let me scroll down. Madehin, please, we really want you to comment. We have from Dr. Sebastian To Farm Halim, it would be nice to know the efforts. Okay, I think we've talked about this. And also, I'll be glad to know your views on increasing tax on these skin bleaching products as a possible, sorry. I think as a possible measure to curbing their use. Sorry, I can't see the full message. Please, Mark, can you comment on that?
Okay, this is what I have to say. This is me not talking as NAFDAC. This is me talking as the layman who purchases skin lightening products in the street out there. As you know, those who deal in SLEs, skin lightening products, are not cheap. It's not for the faint-hearted. If you know how much they charge, it's unbelievable. Now, what you have is, yes, I increased the charge for them bringing it in. They pass it on to their customers. You will be shocked. I wish my colleague, the pharmacist, could speak. I have a few friends who own community pharmacists, and I'm going to be just basically raw the way they say it. They go on and they tell you things like, doctor, this medicine, this is his regular anti-hypertensives, regular anti-diabetics. And he says, doctor, it too cost. I beg, can you reduce the price? Then he goes to the other section of the same pharmacy where you have sales of cosmetics. He buys his skin lightening agents. She buys her skin lightening agents. They don't price it to whatever the amount is, they will pay for it. So our people are ready to pay through their noses. I feel we should put the statistics that dermatologists have, we should put it out there. I saw something in Dr. Cole's presentation where she had made mention of statistics coming from around Nigeria, in the southeast, in the southwest. When we continually throw this...
Can everyone hear me?
Can you hear me? Yes, I can hear you. Can you hear me, ma'am? Hello, can you hear me?
Hello, this is Somadi Gafar.
Yes, we can hear you. We can hear you very well.
Okay. I think the network is a bit better now because I have to move from where I was to another location. I have to move to another location. I don't know if it's okay. If you can hear me now. Can you hear me?
Yes, we can continue.
Okay, thank you so much. Thank you so much. I will just make it very brief, my contribution. Yes, I'm quite delighted to be invited to this forum, and I was able to follow the two presentations, the one by NAFDAC and the other one by the first speaker about talking about the science and the pharmacology of dermatological agents. I just want to make a contribution on, on how, all the problems have been stated quite all right. My contribution on how we can find a solution, to this problem. And I divided this solution into three aspects, looking at the problems. The first aspect is that is regulation. Because we cannot isolate what is happening in the dermatological cream sector. We cannot isolate it from the general, chaotic distribution of drugs and medications in Nigeria. We cannot isolate it. We talk of open drug markets, and I want to give kudos to NAFDAC in what they are doing recently. And I hope and pray that God will give them the wherewithal, to sustain this, this noble effort that they are making to ensure that open drug market menace is stopped, because we are all victims. We are all victims of this menace. Because these medications is consumed, by everybody, irrespective of status, irrespective of gender, irrespective of age. So that means we are all at risk. So, and like I said, we cannot isolate this issue that we are addressing today from that general problem. So that's where regulation comes in. The regulation needs to be strengthened. And I heard from the NAFDAC perspective, they were talking of reporting. We know that, okay, you cannot know that something illegal is being done somewhere without getting a report. But how far have they performed in the previous report system that they are getting? When they get reports that, okay, for example, if you are going through the market and you discover that some of these creams, like I've seen several times that I even took the picture of companies, doing a marketing campaign of triple action drugs in the open market. Like they normally do when they are promoting milk, when they are promoting Bonfita, when they are promoting some other products. They promote triple action creams in open drug markets. Openly, having a kiosk and getting a band to come and dance, getting dancers and things like that. I've seen it, that I've taken pictures. So how responsive is the regulatory agent to some of these reports when it is passed to them? So that is in that area. So then government too, they need to strengthen these regulatory agencies with resources, man and finances, to be able to, meet up with these challenges. Then the other aspect is education, because most of the people that use these, creams, indiscriminately, it's out of lack of education, because they don't understand the long-term effects of these products on their system. They're only looking at the superficial or external effect, or what is it having on them, that okay, they want to lighten their skin, okay, their skin get lightened and things like that, forgetting that these are potent medical, potent chemical agents that get absorbed through the skin into the bloodstream and move to other organs of the body. They don't know, and that the cream that they are applying indiscriminately can even lead to liver diseases. It can lead to kidney diseases and the rest like that. So, but if they get this education, if they are well educated through campaign, and it is everybody, all of us, not only dermatologists, all of us, in the health sector, that we need to collaborate and develop campaign materials and be involved in all this advocacy to educate the members of the public. See, as I'm a community pharmacist of over 30 years now, and I know that some mothers, they come and ask for triple action because they want their baby. They say they don't want their baby skin to become darkened, and they mix it with other things and apply, and we educate them that this is not good enough. So this education is important. Then the third aspect is collaboration. And then when you got collaboration, I talk of referral system, because community pharmacies, which I represent, it is the first responder for most of these patients. They are in the neighborhood. They are the people they go to first. So but if there is a referral system, between us, that okay, if somebody comes to me now that I come with a skin issue, and I have the contact of dermatologists that I can, at my fingertips, I can tell them that okay, I'm referring you to so person in so place, and many of them will gladly go. But if you are saying go to general hospital, go to this thing, there's already an apathy with government hospitals, by these communities. So there is need for us to have a kind of referral system among us, so that we can do some referral. And then when we do referral, we also need a feedback. I send the patient to you to look at it, I deserve a feedback that, okay, we have seen this patient, drug A, cream so is what this patient will use. And then it is referred to me. So I become motivated to continue with such referral. So these are the areas. I'm sorry if I've taken up your time, and I'm sorry for joining very late. So these are the areas that I want to contribute. Thank you very much.
No problem. Thank you so much, sir. Thank you. In the beginning, I don't know if you tackled the issue or the counter and how the pharmacy can stem the sales of such products. Just in 1 or 2 sentences, sir, please. Thank you. So that's most of the question on the chat box. Are there no regulations to stop this? And these things are being stored in plain sight. Please, sir, from Madahan, can you make a comment on the over-the-counter sales of triple action creams? 1 or 2 sentences, sir, please.
Yes. Well, it's all like what I said that about indiscriminate distribution of that cannot be isolated, because I've seen, even go to some of these departmental stores. I've seen this triple action cream displayed at the payment point, conspicuously for people to pick. I don't want to start naming brands now, but these are triple action with potent steroids in it, and it is displayed conspicuously at supermarkets. And my question is, these are big supermarkets. The members of the team of regulatory agencies, are they not going to these supermarkets? What action have they taken when they see such things? As a member of regulatory team, so there is need to look at all these factors. I don't know if I've answered the question. Thank you.
Okay. Could I answer that? I don't know.
Yes, sir. I think that's okay. Very quickly. Thank you.
Yeah, very, very quickly. Now, what are the parts that regulatory agencies do or play when it comes to indiscriminate advertisement and sale of corticosteroids? We have a directorate called the Post-Marketing Surveillance Directorate. If you notice, during the very recent drug raid in Onitsha, on Idumota, and in Aba, it went on concurrently, simultaneously. We mocked everything out. I want to let you know that PMS goes out every day. When we see, we mock them. There are things that we may not come on air to say. It's a daily routine for that directorate. Now, people, like I told you before, people are hard. I found you had made mention of pictures from GAFA that you have. Please, I want to drop my phone number. Send me whatever you have. If we listen to people who have alerts from outside the country and alert our people and go out to mop, how much more when our people have those things in the market? We do not just lie down, we don't sit down. If you give us any information, we act upon it immediately. You notice that what happened in the drug market went on without noise. We have over 87 trailers. Do you know what 87 trailers is? More than 4,000 shops in a single market. People were hiding drugs in building material stores. It's unbelievable what our people do. We will go with the teaching. The teaching will also start with personnel like us. There are pharmacists who will sell. I may close a shop or seize a product. The pharmacist picks up the phone. He's calling somebody who knows NAFDAC. So it's not just putting the blame on the regulator. We own this, all of us. So if you find something, report it. We have several means, several ways you can report. You can go to the nearest NAFDAC office. We're in the 36 states of Nigeria, Abuja and Lagos inclusive. You can go through our online platforms. You can go to www.nafdac.gov.ng, put up whatever you want to do there. We will respond to you. You can go to our pharmacovigilance website. We're there. Med safety app, we're there. But we have to own this as a people. Thank you.
Yes, ma'am. Thank you so very much to all our panelists, speakers. There's so many beautiful comments, suggestions, questions, but because of want of time, we might not take everything. I see so many people from different parts of Nigeria and even in Africa. Only these comments from Professor Lover from South Africa. One of my suggestions is that education has to start in preschool as part of
We can't hear. I think the network is poor or it's from my end.
secondary school is too late, not
I think we've had enough. This is 6:30, 1.5 hours. I think it has been interesting, and it will continue. There will be a part 2, and I think the conversation, like Aisha has said, to continue on our Facebook, IG platform, and any conversation you can send directly to our email. It's been a wonderful day, and it's been long.
Thank you very much, Mr. President. Yeah, the moderator said she went off, that her internet has gone off.
Thank
Yes,
you very
so we should close.
We'll just close. Thank you very much.
Back, we can close, yes.
Yes.
Thank you very much.
Thank you very much to our speakers. Okay, she's back. Thank you very much to moderator. Thank you to our speakers and of course to our members and people who have joined from far and wide. Conversation continues. We'll fight this war together, like Pam Halden said. Thank you very much. Thank you, moderator.
Okay. Good night,
Thank you, ma'am.
everybody. Next month, we'll meet again.
Thank you, sir. Thank you, Prof.
Okay. Thank you very much.
Thank you.
Bye-bye.
Thank you. Bye-bye.